So good evening. MRB exams வந்து முடிஞ்சிருச்சு and we are going to discuss the OG questions that was asked in MRB 2025. Okay, so totally OG lende there were 11 questions, out of which 6 to 7 were like completely from the workbook we discussed. So the first question is, at puberty the number of ovarian oocytes is, what is the answer? This will be 3 lakh. Okay, we've already seen this. Idhula vanditu as you have seen, idla vanditu 2 million at birth நம்ம சொல்லிருக்கோம். Maximum vanditu fifth month of intrauterine life la maximum number of oocytes இருக்கும். That will be 7 million. அதுக்கப்புறமா 2 million oocytes at birth and 4 lakh at puberty. So this was the question asked. So 4 lakh follicles at puberty. So options are வந்து 3 lakhs இருந்துச்சு. So that will be the perfect answer. Okay, so நம்மளோட similar answer வந்து led about day 24ல வந்துட்டு கேட்டிருந்தோம். அதுல வந்து maximum oogonia வந்து எப்போ இருக்கும்? That is the 5th month of intrauterine life. Okay, so the answer for this will be 3 lakhs. So the next question வந்து PPH பத்தி இருந்தது. So PPH பத்தி எது true? So PPH may be defined as soaking of more than 1 pad per hour, bright red bleeding with or without clots. B is, it is called secondary PPH if it occurs between 6 hours to 6 weeks after birth. Third one is sublingual misoprostol 600 mg is given. And D is trauma to the genital tract is the most common cause of PPH. So idhula vandu nama rule out pannittu vandale we'll get the answer easily. Okay, we'll go from the option D. So trauma to the genital tract is the most common cause. We know the most common cause of PPH is atony and not trauma. And third option, sublingual misoprostol 600 mg kadiyadu. It's not sublingual, it is perrectal. Okay, and it is not 600 mg, it is 800 micrograms and not mg. Okay, and B option, it is called secondary PPH if it occurs between 6 hours to 6 weeks kadiyadu. Number 24 hours varikume we call it primary. Okay, so in the moon option may false, and so the first option will be the right one, which is soaking of more than 1 pad per hour, bright red bleeding with or without clots. சரியா? So இதுதான் நம்மளோட workbookல இருக்கிற PPH, and if you see the ml வந்து 500 ml of vaginal delivery க்கு அப்புறமா இருக்கிற this PPH. This was one of the options. Primary வந்துட்டு it is within 24 hours period, and the other one is most common cause will be atony. We have already seen. Okay, and dose of misoprostol வந்துட்டு per rectal தான் நம்ம வந்துட்டு யூஸ் பண்ணிட்டு இருக்கோம். So per rectal 800 mcg, right? So answer is A. So we had a similar question in MRB OBG question number 22, which is most common cause of primary PPH in atonicity, and that we have discussed the other causes also. Fine. Moving on to the third question. Third question one, the accurate parameter for assessing the gestational age by ultrasound is, it's a very simple and straightforward question. The answer is CRL, crown rump length, right? In the math options lamu, there are parameters, and the best mark is CRL, which is seen in the first trimester. In case one, the first trimester is specific, it will be CRL, and second trimester is specific, that will be HC, that is head circumference. Since it's overall normally CRL will always be the best parameter. Okay, so this is our notes. In this, if you see, we have the first point, overall best parameter to determine the fetal age is the crown rump length. This is the direct questions, straightforward question. Fine. The same question வந்துட்டு நம்மளோட MRB OBG question number 18 லயும் இருக்குது. Best for the estimation of gestational age the first trimester, be it first trimester, second trimester, எல்லாத்துக்கும் overall பார்த்தோம்னாலும் crown rump length will be the best answer, right? Okay. Fourth question, methods to assess fetal well-being are. Fetal well-being எது வச்சுல assess பண்ணுவோம்? Fetal movement count, B is NST, C is ultrasound examination of the umbilical artery, and D is all of the above. So we know this all of the above. So நம்ம வந்துட்டு fetal well-being வந்துட்டு நம்ம வந்துட்டு sorry okay, fetal well-being வந்துட்டு நம்ம biophysical profile வச்சு பார்ப்போம். Biophysical profile there are 5 parameters, which is Batman வந்துட்டு fetal breathing movement, A is for amniotic fluid volume, T is for tone, இன்னொரு M is for body movement, and N is for NST. So இதுல வந்துட்டு body movement count and NST கொடுத்திருந்தாங்க. So these are 2 of the options. அதுக்கப்புறம் ultrasound to see the Doppler கொடுத்திருந்தாங்க. So all of the above is right. Okay, So similar question வந்துட்டு components of the biophysical profile included all except the tone, fetal measurements, fetal breathing, and amniotic fluid volume. This was a question in our MRB thing. Okay, fine. Most common site affected by genital TB is straightforward question. Very, very easy. It is at fallopian tubes. Okay, so fallopian tubes will be the answer. So இது வந்து இதுலேருந்து வந்து direct question. Most common site will be a fallopian tube. Okay. And there will be 100% involvement of the fallopian tube if there is genital TB in a person. So this is a direct question. Most common symptom of genital tuberculosis is infertility. This was asked in the practice papers. Fine. What are the vaccines contraindicated during pregnancy? What are the vaccines contraindicated except that is what can be given அப்படின்னு கேட்டிருந்தாங்க. So we have இதுவும் வந்துட்டு நம்ம இதுலேருந்து வந்த ஒரு direct question. The answer is anti-rabies. நம்ம வந்து இதுல பார்த்திருந்தோம் ABC rabies அது வந்து கொடுக்கலாம் அப்படின்னு நம்ம சொல்லியிருந்தோம். So hepatitis A, hepatitis B, pneumococcus, meningococcus and rabies. So இதெல்லாம் கொடுக்கலாம்னு சொல்லியிருந்தோம். And the other options were MMR, BCG and varicella. All these are contraindicated. Fine. This is a direct question from here. அதுக்கப்புறம் 7th question. The pharmacological methods recommended and approved for cervical ripening. So cervical ripening எது cause பண்ணுது அப்படின்றது the most commonly used one is PGE2. PGE2 which is known as a dinoprostrone gel. So this is an easy question. So நம்ம inductionக்கு யூஸ் பண்றது ரெண்டு தான். ஒன்னு வந்து மெக்கானிக்கல் and the other one is pharmacological. மெக்கானிக்கல்ல நார்மலா யூஸ் பண்றது is Foley induction and நம்ம வந்துட்டு cervical ripeningக்கு யூஸ் பண்ற pharmacological method is dinoprostrone gel. Misoprostol is also used but not as common as the dinoprostrone gel. Okay, so இது வந்துட்டு PGE2 analog dinoprostrone. Okay. So இதுக்கு similar we had a question on misoprostol. Misoprostol வந்து induction of laborல யூஸ் பண்றோம். What type of prostaglandin was it was the question. இதுல PGE2ல வந்துட்டு it is the dinoprostrone. Okay. 8th question. What are the sites of endometriosis? Sites of endometriosis: ovarian, rectovaginal, umbilicus, and scar. All of the above. This is an easy question. It's all of the above. Most common site of endometriosis will be the surface of ovary. Ana ovary thavara the extra pelvic நிறைய இடத்துல வரலாம், including scar and rectovaginal areas also. So all of the above will be the answer for this. Fine. And what is the commonest cause of vesicovaginal fistula? So what is vesicovaginal fistula? Vesicovaginal fistula means there is a communication between the genital tract and the urinary tract. இது ரெண்டுத்துக்கும் நடுவுல வர communication will be a vesicovaginal fistula. Vesicovaginal fistula ஓட three most common causes are obstructed labor. Second one will be avascular necrosis of bladder. And the third one will be post-radiation. Okay. So, idhila vandhu most common cause will be an obstructed labor. Adanal inga vandhu the most common cause will be an obstetric cause. Fine. Okay. அடுத்தது ultrasound appearance of endometriosis. Endometriosis எப்படி இருக்கும் அப்படின்னு கேக்குறாங்க. So first one is coarse internal echoes with solid area. Echo free cyst with low level echoes and thick cyst wall. 3 C is pins and needles, and the fourth one is mural nodules. இதுல வந்துட்டு it is easy to like eliminate the others. So first one நம்ம பார்த்தோம்னா solid areas. Solid areas அப்படின்னு கொடுத்ததுனாலே it means they are telling about malignancy. Endometriosis is not malignant, so in the option it's not right. And அதே மாதிரி mural nodule கொடுத்திருந்தாங்கனாலும் it can be malignant. Mucinous cystadenoma சொல்றாங்கன்னு அர்த்தம். It is not malignant, and this is a random option. So இதோட best option வந்துட்டு this will be the keyword for us. Low level echoes. So endometriosis எப்பவுமே low level echoes தான் இருக்கும். So அந்த cystல வந்துட்டு cystக்குள்ள there is only low level echoes. If you have seen, it will be like ஒரு homogeneous இந்த மாதிரி full-ஆ ஒரு low level echoes இருக்கும். அந்த cyst wall மட்டும் தான் வந்துட்டு it will have a thick cyst wall. So this will be the best answer, and this shows endometrioma. So endometrioma will look like a cyst இருக்கும். It will be filled with a low level echoes. Okay, so that will be the answer. And the 11th one, in a partogram, if the curve crosses the line to the right, the cause may be due to. Okay, so இது மாதிரி இருக்கும்போது this will be the alert line and this will be the action line. இதுதான் ஒரு நார்மல் பார்ட்டோகிராம்ல இருக்கும். சோ இவங்க என்ன சொல்றாங்கன்னா நம்மளோட லேபர் கர்வ் வந்து இப்படி ரைட்டுக்கு போயிடுச்சு அப்படின்னு சொல்றாங்க. சோ இந்த ரைட்க்கு இருக்கிற லைனை கிராஸ் பண்ணிடுச்சு அப்படின்னு அர்த்தம்னா there is a delay in laborன்னு அர்த்தம். அது வந்து வேணுன்ற ஸ்பீடுக்கு it's not going. So அதனால the causes can be CPD, malposition and inadequate uterine contractions. இதுல வந்து the key which was given, it had fetal hypoxia as the answer. I think the question must have been if the labor curve curve causes to the right, the causes may be all due to except in Nanikra, and an except was not given in the key. But the answer must be like all three are right, and this was the answer given. So I hope like that there was an except in the question. Okay. So so in the curve on the right there is a delay in labor. Adhanala the causes may be cephalopelvic disproportion, inadequate uterine contraction, and malposition. Nothing idukkum fetal hypoxia, there's no relation. Fine. So these were the questions on OG. So total of 11 questions, out of which 6 were like direct from our workbook. I hope you all did well, and we'll like wait for the results. Thank you.